Okay, perfect. The time is 2 o'clock, and I think all of the joinees have joined. Are we waiting for some more people, sir, from your side?
Just let's head on.
We'll begin, is it?
Yeah.
Okay, perfect. So, welcome everyone.
So thank you.
Yes, sir.
You go ahead. You are the boss.
Thank you, sir. Thank you. So, welcome everyone. Thank you so much for joining us today on yet another learning journey. This happens every Saturday at 2 p.m. And we try to uncover the various opportunities and career paths for pharmacy professionals through these learning journeys. And today's topic happens to be the role of pharmacists and pharmaceutical practitioners in patient care. And our today's speaker, Dr. Kannan, happens to be a proud pharmacist. He's a patient advocate. He's also the founder of SignaMed Integrative Medicine and Functional Nutritional Wellness Center, which is based out in between Bangalore and Chennai. So, Dr. Kannan, if you can switch on your video and just wave so that participants can see you.
Hello.
All right. Perfect. Good to see you, sir. So, Dr. Kannan,
Yeah, to see you.
Dr. Kannan happens to be, yes, sir. I'll just briefly introduce. Sorry, sir. I'll just briefly introduce you, and then we'll proceed ahead with the session, sir.
Yeah.
Okay. So Dr. Kannan has done his MPharm pharmacology, PhD pharmacology. He also did his postdoc and MBA. His profile extends to a number of pages, and I'm sure we need another separate session to cover all his qualifications. So I'll not get into that, but I'll just briefly tell about Dr. Kannan. Kannan has been advocating integrative medicine and functional nutrition, especially for the management of chronic disease for all the age groups. And his special interest is in the management of age management and regenerative medicine, women and child health, malabsorption syndrome, recurrent infectious disease, development disorders, diabetes and metabolic syndrome, organ failures, autoimmune disorders, rare and orphan disease. So practically he's covered the entire spectrum of all the diseases that happen, and he's trying to play a very crucial role as a pharmacist to take care of these diseases, to alleviate the suffering and pain of the patients, to ensure that the patients lead a quality health and life. That's what he's trying to do through this integrative medicine. And with this short intro, I would request Dr. Kannan to share his story first and then continue with today's topic. Thank you so much, sir, for being with us.
Yeah. More than being a proud pharmacist, I would say that I'm a proud Indian. Traveled to 103 countries, including Amazon. I lived in Amazon for 6 months. So I'm here in the foothills of the Western Ghats, the largest rainforest in the world. After having traveled, 51 years of my life, 14 years of education, and the remaining is my learning. I'm still learning. There is a crisis what we are facing in the world, which is next to nothing. We are in the edge of transforming human life towards survival. It's not thriving, it's survival. Thanks to Manoj, Manoj and me, we know each other for a couple of years. But he's been a relentless warrior to empower pharmacists across the world to provide their pharmaceutical care and patient care and healthcare. I'm happy to address you all at the age of 51. My background is there visible in your LinkedIn profile, blah, blah, blah. Then, education is not the end of, you have to put education to practice, both at your home as well as people who are waiting to, make use of your knowledge. Knowledge is to acquire, but practice to empower people who want to avail your solutions. So we are sitting in a situation where world healthcare is got plenty of stakeholders, from home to pharma to marketing to food industry to medical industry, pharmaceutical industry. Today, we have to have in order to understand where we all stand as humans. We not only have responsibility to save, we have the responsibility to save the planet we are living, so that our future generations will not look back in anger. So I want to start the session, probably if you can share, Manoj, the slide. Can you?
Yes, sir, of course. I'm just sharing the slides. Here we go.
So the slide is titled as Role of Healthcare Providers. I don't restrict my addressing of the audience to pharmacists alone, but we're all part of the whole healthcare system, stakeholders. And if you could just pass on the slide, now that's the next one. So I had put these two video slides. I was interviewed by Dr. Philip Miller from UK way back in May 2030. Now he reached out to me after trying to reach out to the world and explain what is a pandemic about. So I've given interviews. One is May 30th, 2030, the other one is May 2021. So this is pre and post vaccination era. Within 3 years of our lives, we have seen enough of pain, suffering, insecurity, socioeconomic problems, and there is a lot of conspiracy theories going around this pandemic, but then nobody knows that we have our ancestors and the human race has covered more than 90 pandemics in this world. And we are still surviving and thriving. This is not the end, but it is just the beginning of creating a responsible and sustainable healthcare. Next slide. How do we do this? We have to have a collaborative, integrative, and partnership approach so that we can take care of patient-centric healthcare. As much as we gain knowledge or we even reinvent the wheel, from what our ancestors or poor have translated knowledge into practice, we have to integrate not only healthcare and functional medicine, nutrition, these are all jargons, but we have to integrate ourselves as healthcare providers. If we do not even attempt to do it, we are heading towards extinction of the human race. Not in far away future, less than a decade, or less than a century, or less than a half a century. Next slide. SignMed, which was basically called christened in 2014. The name SignMed refers to signature medicine. Why signature medicine? Because every medicine and legal practice and the healing process, treatment process, be tailor-made to individuals. So signature, it has to be signature medicine. It took a long time for me. Prior to SignMed, I formed a company called Alticure Research Private Limited. Alticure is alternative and higher cure, Alticure. Now, I had formed that company because I was a research practice in the pharma industry for 31 years. And none of the research we do in the lab or translated into practice, it can reach the people.
Sir, sorry to interrupt. The internet seems to be a little patchy. Your voice is breaking. Participants, please confirm if you can hear him clearly, or you are also.
I can hear. Can you all hear?
The audio is not clear, sir. Your audio is not clear. It is patchy.
Hold on a second.
Yeah. Okay. Or if you want, you can also switch off the video so that we can save on the bandwidth, and then you can switch on the video during the Q&A.
Yeah, sure.
Yeah, so that we can have the connectivity better.
How about now?
Yeah. Now, participants, please confirm you can hear me clearly.
Hello.
Yeah, better.
Hear me?
It's better, sir. Yeah, please.
Yeah. So, if you look at the traverse of modern medicine the past 200 years, there's so much of reinvention of the wheel happened in terms of catering to illness, surgeries, organic and inorganic diseases, in a desperate attempt to improve public health and hygiene and thriving of the human race. Next slide. Now, but then there's a certain amount of failure. Nobody is perfect. No system is perfect. No individual is perfect. No living being is perfect. So the failure of modern medicine was fuel because they functioned in isolation. In order to address all the diseases and illnesses what human race is facing. Plenty of christening of diseases. Apparently, our forefathers in the age-old medicine, we call it the Tamil medicine, you could call it the Siddha medicine, you could call it the alternative system, what. They have coined only 4,448 diseases within a human body or a living being, especially mammals. But then modern medicine kept on exploring and coining diseases, which is becoming endless. So we had to put a stop and listen. There's always a pit stop for everything, even a Formula One race. So we got to fuel ourselves with the knowledge what has been acquired and transferred for generations, time tested, people tested, to see where we stand. Next slide. So the bottom of this slide says you do better when you know better. So as pharmacists or healthcare providers, we have to know better before empowering our own patients. If we do not learn better and acquire the knowledge and translate the knowledge, we cannot empower them to make informed decisions in their lives. Next slide. So in order to do that, we have to rethink the way we view the disease process itself. So if you look at the first statement, it says it takes an average of 17 years of research evidence to reach clinical practice, which means most medical practices are outdated before it reaches the patient. Now, because of our disease process are highly individualistic, highly heterogenic, complex, the solution is not always linear. So, talking about linearity, today's AI and ML cannot even contemplate what the human body is, because what you feed in is what the machine learns to deliver. So if it is rubbish in, it will only be rubbish out. Because chronic diseases are complex and they have a completely different way of thought process. They cannot be prevented by vaccines or cured by medicines, nor do they just disappear on their own. They do disappear on their own, only if you enable the human body to heal itself. Next. Some of the major health damaging contributors that lead to chronic diseases include tobacco use, lack of physical activity, poor. Honestly speaking, this is just a statement. While I am speaking to you, I do have habits. We all have habits. We smoke, drink, and everything in moderation. Everything which we do so that the body heals itself. Drinking coffee and tea is also a habit. Using mobile phones and computers or processed food, they all also become habits and habituation, addiction to an extent. So what is essential is to advocate and educate the population, our target population, which are the patient, to make them understand what we have understood with our degrees and trainings and whatever. Not all the time you can preach what you practice, but then at least you can make an effort to do that. But we as healthcare professionals have a humongous responsibility to translate our knowledge into practice. The audience who are watching us, listening to us, probably reaching out to us in hospitals, pharmacies, retail pharmacies, wherever, you have to tell the truth. You can't be influenced by the stakeholders in the healthcare ecosystem. Next. So in order to do that, we have to get to the root cause of the disease process, the socioeconomic problems, the psychological problems. And we have to be empathetic enough to understand what they want and what they cannot afford. Next. So there is a need for sustainable integrated healthcare as a result of all this menace what has been created in 200 years. Next. Next. So if you want to explain what is integrated healthcare, have a slide, share that. But why integrated healthcare? Because the disease process is complex. The disease process requires mechanistic evaluation of the disease and root cause analysis by contribution from various knowledge providers, be it allopathic medicine, Siddha, Unani, Ayurveda, Reiki, homeopathy, whatever it is. So integration is essential. Then sustain, because if you don't sustain, neither you as a health provider can survive, nor the patient who are seeking your health care cannot survive. Then comes affordable medicine. Next. So you can pass on the slide. Go on. This is storytelling. So let's take an example of a root cause. The most common, we all diabetes. Diabetes is not a disease, it's a disorder. Like any other metabolic diseases or illness, it's a disorder. So if you look at the root cause analysis, it happens long before the body gives up. 15 to 20 years, people suffer from pre-diabetic conditions. And then it goes into overt diabetes after 15 to 20 years, and then it goes into complications and death, eventually death. So there is an opportunity for all of us to empower the patient population to have primary, secondary, tertiary, whatnot, prevention. Only if you understand the disease process yourself. You can't magically reverse the natural progression of any disease process if you do not understand the root cause at every stage. Next. So understanding your nutrition or their nutrition, your clients, your patients, and the need for supplements, if only required, is essential. Next. So we all know the root cause. Why we are all suffering from diabetes, endocrine disorders, hormonal imbalances, women and child health, malnutrition, whatnot. It's a wrong nutrition and the processed food. The food industry and the pharma industry have been hand in glove and in partner in crime. All at the cost of our own ignorance, not the patient. We have all studied pharmacy, medicine, nursing, whatnot. But while we are studying, we didn't question the norms. We didn't question the real facts. We didn't question the books we study. When I take a class, either in pharmacy school or medical school or nursing school or any life science institution, I ask them to keep the books away. Come and ask me questions. Come and discuss. You cannot learn if you do not ask questions. Next. So the solution is there only when you understand. Next. So lifestyle and environment, we all know all this, but we're not working towards it. Go on, go on. Next, next, next. Next. So this is very important. EBM, evidence-based medicine or evidence-based science. The root causes has to be understood. The primary drivers of disease process have to be understood. The pre-disease conditions have to be understood. You have to embrace all the systems and solutions available in this world, which has been documented in the previous centuries or current century. Everything has to be digested. So that's why I say we have a very large responsibility because we are loaded with information. Information is good, but acquiring knowledge is good, but putting to practice requires prioritizing. How do you prioritize? Depending on the audience you get it. A patient will come with diabetes, but when you sit and talk to the patient, spend time listening to them. Please don't talk. Don't talk before the patient stops talking. Listen to them. When you listen, you learn more. When you listen, you can diagnose. When you listen, you can understand the root cause. Next. So there's a lot of role of integrative medicine and functional revision when you in the current situation. The conventional medicine works of a drug disease model. The patient comes in with a complaint and a diagnosis is established either through clinical examination, imaging, blood test, whatnot. But then if you don't address the root cause, the entire system fails. Next. So the root cause and the solutions is what pictured in this slide. Treating the individual's root cause of the disease is vital. You can't treat the disease, you have to treat the patient. If the patient says, I've got a headache, so you have to treat the headache. But then you have to make sure that the patient doesn't get the headache again. That happens only when you remove the root cause. Next. A typical example, Parkinson's or Alzheimer's, whatever. Look at the root causes below, and then you have very few symptoms. So the cause of the tremors has got what? Some 20 odd root causes. If you don't correct those root causes, you can't treat a condition like Parkinson's. Next. So therefore, we at SignMed, after realizing the flaws in the current system of medicine, our own flaws as healthcare providers, we had to come together. Everybody's got a role in this. Pharmacists are the beacon of healthcare. That's why I call myself a proud pharmacist. Like all of you, when I was a kid, I wanted to become a cardiothoracic surgeon, doctor. I screwed up in my CET or entrance exam. I got 17 marks in physics, 50 out of 50 in all the other three. And then my mom said, well, give it another attempt. So I enrolled myself into BSc. Then somebody told me, no, don't waste your time, join pharmacy. So the moment I finished my first year of pharmacy in Government College of Pharmacy in Bangalore, I decided that it's not the degree which matters, it's what you do what matters. So I continued my profession of pharmacy. I did my PhD in cardiovascular pharmacology to satisfy my inner desires of becoming a cardiothoracic surgeon. Not many people in this world know that I invented or discovered the cardiac stent, which is drug-coated stent. So I've done all what I wanted to. It all depends on what you aspire to. So the approach of learning, practice, and deliverables is more important than your degrees. Please understand. Unfortunately, in a country like India, there are too many graduates before even preparing ground for their employment and practice. So what is the reason for that? Can we complain ourselves or the system? As Rajinikanth says, system is bad. No, it's not the system. It's our own greed. Somehow something will happen. Why do pharmacists and medical graduates and mechanical engineers go into IT industry? How can you spend 6, 7 years, 9 years and walk into something which is not your own domain? So that's desperation. That's because you've not reinvented yourself. Next. So we need to create optimal healing environments. If we cannot do that, we cannot be respected by the audience we are supposed to address. You don't earn respect from demand. You earn respect, fame, money. It has to follow you. When you reach a situation where people praise you for healing them, even billions of dollars is nothing in front of it. Every single pharmacist in this country, I demand you have to adopt at least one village. 3 months in a year. You go and earn your money. You go and earn money. 3 months, go and spend that. Look at the world from that part of the world. You will understand what are you and what is the rest of the world thinking about you. Next. So when you want to create an environment that enhances the person's ability to heal based on whatever care principle. So you need to create intention and awareness. You have to make them understand the whole body system. You have to make them understand the relationship between care providers. That is patient advocacy. If the patient says, I want to buy 2 antibiotic tablets, and that's me. Or if they want to do an X-ray alone instead of a CT scan or an ultrasound, you have to explain to them why you need a CT scan, why you need an ultrasound. So when we don't collaborate, patients cannot even trust us. Eventually, the spiritual connection, spiritual, I don't mean by religion. The human body is a spirit formed of 5 essential elements in this world. We all have to first heal ourselves before we try to heal the rest of the world. So get yourself into that spiritual connection. Understand who you are, what are you formed of, what is this world about, what is this planet about. Don't waste your time on conspiracy theories, Elon Musk or whatnot. Next. So the integration comes when you truly integrate everybody's knowledge. There should not be once, even in a single day, you should not use the word I know. we should use the word we know. Then only the patients will believe. The moment you say I know and you fail in healing them, then they will brand you as quack. Next. So look at the armory, the weapons we have. We have all kinds of testing and blah blah blah. So Manoj was like listing down the objectives of this whole talk. Now I'll give you a simple example. Let's talk about the root cause of malnutrition or anemia. The best you would have studied in your curriculum is you have iron deficiency anemia, you have B complex deficiency anemia, blah, blah, blah. That is what is modern medicine is taught. But the ancient system looks at the body as a whole. So you need to have a gut health, you need to have a mental health, you need to have physical health, you need to have connection to the body ecology, with the nature's ecology. If you don't do that, those are the root causes for the diseases. You can't heal the patient with drugs and supplements and pharmaceuticals and vaccines and whatnot. So all these innovations which has happened in 200 years goes down the drain. You have to integrate your learning. Please go in search of truth. Go in search of learning. Go back in time before going to the future. So prediction, then comes prevention, then comes precision medicine, then comes personalized medicine, the 4 P's of whatever we call it, modern medicine or future medicine. Cannot happen if you cannot go back and learn. Look at yourself around you, the place where you sit, the places where you go. There is abundance of solutions. Your patients do not have time to go and look up. So you have to look up and translate that information into patient-centric knowledge. Next. So next. These are all explanations of what we do. You know, you can do 5 lakh worth of tests and 500 rupees worth of tests, still make a diagnosis and treatment. So if you're complaining that patients don't pay me, whether it is doctors, pharmacists, nurses, they don't want to pay you because you're dependent on something else. So the weapons which has been created, or the solution which has been created by the medical devices industry and the pharmaceutical industry, you have become addicted to it. You have become so dependent. So why should I, as a patient, pay you for the knowledge which you don't even provide? So it will take another 20, 30 years if you want to take over. Use the technology. I'm not saying you should come out of the technology. Yes, they're all tools. But if you don't empower your knowledge, you should be ashamed if you don't do that. And you should admit that you can't demand respect and the remuneration is what you think you should have. Next. So the bottom line is, this is just the beginning, and Manoj is a messiah. I would only want you people to just keep a track of what you're trying to do. If you have your time, please join us for the following events.
So please switch on your video as well.
Yeah. Start my video. Yeah.
Perfect.
Okay.
So thank you so much. Thank you so much, sir, for that thought provocative pointers that you shared with us today. I think you have given a recipe for self introspection. And unless we realize the importance of providing true care to the patients, we can never succeed in our goals to provide healthcare to all. And such a profound statement you gave today. Why should a patient pay to me if I don't use my knowledge to provide a true care to that patient, right? Such a profound statement. I think this gives a clarity to all of us who are just hoping for some money from the patients and without actually providing some care to them. So thank you so much, sir, for that wonderful, special session that we did today, especially for
I
some of
hope
our.
I hope the video and audio was good, but we'll still, we will share this whole thing across.
Yeah. So we'll share the recording of this session to all the participants, and all of the participants who are on Zoom today, you'll also be getting a participation certificate from us. So thank you, and stay connected with us. You can ask your questions. We'll take up some questions from you now. So you can raise your virtual hand on Zoom, and I'll give you the option to unmute. You can ask the question directly to Dr. Kannan. And if you want, you can also switch on the video. We love to see you, and that's how the interaction becomes better and better. So participants, you can ask questions now. You can switch on the video, or you can give me an option so that I can unmute you. So you can go ahead and ask the questions. Let's see if you have some questions. Did you like the session? Did it create some kind of thought provocation in your mind? You got to ask questions. Unless you ask questions, you'll not get the answer. And I requested Dr. Kannan to provide internships to our PharmDs and our pharmacy students who are interested in getting into integrated.
My target is next 5 years. If I can employ at least 1.5 lakh pharmacists, I'll be so happy.
Thank you, sir. So Mohammed Taha, you can unmute and you can ask the question. You can also switch on the video if you want to.
Good afternoon, sir. Good afternoon, sir.
Good afternoon, Mohammed.
Good afternoon.
Sir, I am fourth year BCom student in Sankali University College of Pharmacy, Tamil Nadu.
Okay.
Sir,
Go ahead.
Sir, I'm interested in medical summarizing and medical transcription role, sir. How do I approach the language forum?
Language is not a problem.
Oh, sir,
Language
Tamil.
cannot be a problem. Should not be.
Sir, are you understand my question?
I do understand. Okay. So if language is going to be a constraint because you want to do medical transcription and blah blah blah, I think you should change your profession, change your approach. Because don't waste time. You can't learn English to an extent what an American or a British or a rest of the world expects. So with your knowledge of pharmacy, come and start practicing pharmacy. I need people who can speak the native language.
Yeah.
You speak Urdu, you speak Tamil, that's good enough.
Okay, sir. Sir.
I'm not stopping you from going and doing medical transcription.
Sir, B.Pharm is...
Yeah, go on.
Sir, B.Pharm is sufficient qualification for medical transcription and summarizing.
No. They don't need many B.Pharm and BDS graduates or MBBS graduates for medical transcription. They need people who can translate. So you're in the wrong domain. So you have to make a quick decision.
Okay, sir.
Thank you.
Good decision which what is, sir?
You come and practice pharmacy.
Pharmacy practice in PG course.
Whatever you have learned.
No,
I interested in patient care also, sir. So I interested in the medical
so
summary.
that is enough. Your B Pharm is more than enough, Mohammed.
Okay, sir. Okay, sir.
So
So connect with Manoj.
Okay, sir. Thank you, sir. Thank you so much, sir.
Thank you, Mohammed. So what basically Dr. Kannan is telling us today is, whatever you have learned, try to utilize those learnings and provide patient care. And he is welcoming a lot of interns to join him. And you don't have to know English language only. If you are convenient in your local language, that is good enough. And he'll be providing an internship to you. So if you are interested, you can connect with me, or you can also connect with Dr. Kannan. So first slide, he had given the contact details of his email ID was also mentioned on the first slide. So you can directly write an email to him if you're interested to join as an intern with him or work with him, or else you can send an email to me as well, and then I will share the information with him. So he'll be
Sure,
offering.
sir.
Perfect. Thank you, Mohammed. So any
Thank
other
you, sir.
question?
Thank you very much.
Perfect. Thank you. Anybody
Yes, sir.
else?
No, sir. Thank you.
Thank you. Thank you. Anybody else wants to ask a question? Please raise your hand and ask the question specifically related to this session only. So we are working on a time bound session. So if you have questions, please ask specific to this session only. And if you're interested to work as an intern or do internships in patient care or integrative medicine, you can ask a specific question relevant to that topic. So Dr. Kannan will try to answer, and I'll try to answer those questions. Okay, anybody wants to ask a question? Akshat, Chanchal, Dr. Abhay, Harshita, Mohini, Sangamitra, Sika, so many of you are there. Why don't you ask questions? If you have something in mind, you can ask, or if you don't want to ask, you can put in the chat box. I'll read the question for you, for Dr. Kannan. Anybody wants to ask questions? Yes, Nikhil, go on. You can ask.
Hello.
Yes, Nikhil, go on.
I'm interested in internship.
Okay.
Yeah.
So what is your question?
You want to speak in Hindi, Nikhil? You can speak.
Yeah. सर मैं अभी MBA फार्मा कर रहा हूँ, तो मुझे इंटर्नशिप चाहिए मेडिकल मैनेजमेंट से रिलेटेड.
आप वेयर आर यू फ्रॉम? गांव किधर है आपका?
आई एम फ्रॉम महाराष्ट्र.
Maharashtra. Okay. So would you like to come to Tamil Nadu?
Yes, sir.
Okay. So you don't need to know English. You don't need to know Tamil.
Okay.
If you can speak Hindi, that's good enough.
Okay, sir.
So send the resume to Manoj or to me.
Okay, sir.
Whatever. Then we'll take it from there.
Okay, sir.
And God bless.
Thank you, sir.
Perfect. Thank you, Nikhil. So we'll wait for your resume, and then we'll see how we can work together. Okay, perfect. Anybody else? Mohammed Taha. Okay, you can ask. Go on.
Sir, Tamil பேசலாமா சார்?
பேசுங்க.
சார் இப்போ பேஷண்ட் கேர்ல இன்டர்ன்ஷிப்னா எந்த மாதிரி சார்?
பேஷண்ட் கேர்ல இன்டர்ன்ஷிப்னா பேஷண்ட்
ஹாஸ்பிடல்ஸ்ல சார் புரியல.
பிரைமரி ஹெல்த் கேர் சென்டர் இருக்கீங்க.
ஆமா சார்.
அங்க வந்துட்டு நீங்க பேஷண்ட்ட டாக்டர்கிட்ட போறதுக்கு முன்னால நீங்க பேஷண்டோட ரெக்கார்ட் எல்லாம் எடுத்து translate பண்ணிட்டு டாக்டர் கொடுக்கணும்.
ஓகே சார். அது எங்க தமிழ்நாட்டிலே அவைலபிளா சார்?
தமிழ்நாட்டுல தான். ஏலகிரிக்கு வாங்க.
எங்க சார்?
ஏலகிரி.
நீலகிரி. ஓகே சார், ஓகே சார். ஏலகிரி, ஓகே சார்.
ஜோலார்பேட்ல இருந்து மேல.
வேலூர் டிஸ்ட்ரிக்ட்.
ரைட்.
சார் இப்ப நவ் கோர்ஸ் வந்து இப்ப எனக்கு பிப்ரவரியில முடியும் சார். இப்ப
அதெல்லாம் ஓகே. நீங்க 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 மட்டும் பேசிட்டீங்கன்னா மத்தவங்க எல்லாம் சான்ஸ் கிடைக்காது. நீங்க ரெஸ்யூம்.
ஓகே சார்.
பை.
Sir, Dr. Kannan, if you could translate that for other participants so that they can also understand.
Mohammed was asking, he wants to pursue a career in patient care. So I told him that I have a private-public partnership with the government of Tamil Nadu, where we employ pharmacists, nurses, lab technicians, physician assistants who provide patient care in collaboration with the doctors.
Okay.
So he asked me, where in Tamil Nadu? So I gave him the location.
Okay. So would you like to tell that location, sir, so that others also can know it?
Graduation in February, I believe.
Okay.
So if all the pharmacists who are listening, please understand, when you want to do your internship in pharmacy in your final year, come and join us.
Perfect. That is specific to patient care.
I will convert that internship into employment. I promise you.
Excellent. That was so kind of you, sir. Thank you.
Thank you.
Thank you. So anybody else wants to ask anything to Dr. Kannan? This is like a golden chance for you to ask any question to him live. Please do ask. He's facing some internet issue. That's why he's not keeping the video on. And no problem. I'm here
now,
to...
let me tell you one more thing.
Yes, sir.
For to all the listeners, if we do not reach out, if we do not ask, you won't get it.
Absolutely. Yeah. Only the crying baby gets some milk.
Always.
Yes, it's always, yes. So participants, if you have any specific questions, this is another 4 or 5 minutes we are here. You can ask your questions and we'll wind up for today's session. Any questions?
I've had a very, very long year.
Yeah, I know, sir.
But thanks to Manoj. Manoj.
My pleasure, sir. My pleasure.
I don't know how to thank you.
It's my pleasure. So
all of you are welcome. You come over. We can celebrate New Year Pongal here.
Thank you so much, sir. Thank you for that invite.
You're all welcome.
Thank you. Thank you, sir.
You have to see this is a model, sustainable society, living and healthcare, which is going to tell the world what we should do in the next few centuries.
Excellent. That was nice. So any final words you want to say to all our participants, sir? And also,
all welcome. My kingdom come, thy will all be done.
Thank you, sir. So perfect. So thank you everyone for your participation today on this Saturday. Again, one more learning journey, and we'll meet.
Wish them all a good weekend.
Yeah, absolutely. Thank you, sir. So a wonderful weekend ahead to you as well. And thank you all the participants for your time and the time that you spend every Saturday with me. I wish you all a wonderful weekend ahead, and then we'll meet again next Saturday. If you're interested to do internships with Dr. Kannan, you can find more about him on LinkedIn. Anyways, I'll be sending an email to you with this recording and also the link to Dr. Kannan's profile and his email ID. So you can contact him directly, or if you want me to help you out, you can reach out to me as well. So this way we'll
spare my profile.
I'll share. Yes, sir. Definitely, I'll share.
There is something which I want to tell finally.
Okay.
We are in a mission possible, not mission impossible.
Yeah.
Thank you, and God bless you all.
Thank you, sir. So, sir, one question has come just now. So this is from Vaishnavi. She says, I'm in 4th year B Pharm right now. Can I attend this internship, or do I need to get into some hospital to learn this?
Now we run hospitals here, so if she wants, she can come here.
Okay, perfect. So Vaishnavi, I hope you got that answer. So if you're interested, you can join this internship and learn more through sir. Thank you.
We will provide you basic living, food, accommodation, and then you got to find your way out. I don't want everybody to come and ask for jobs here. You have to, after our internship, I will help you find jobs, but you have to go back to your roots.
Absolutely. Yeah.
And create this beautiful model what we have created across this beautiful country and the world.
Absolutely. So perfect, sir. So thank you so much for your time, and thank you so much for your time, participants. We'll meet again next Saturday at 2 p.m. And until then, goodbye and have a wonderful weekend ahead. In case you are interested in one internship, then please do reach out to Dr. Kannan or me, and then we'll reconnect back. And your participation certificates will be sent out to you via email. So please check the email from my side and check the spam folder. If you have not added my email ID, then most likely it will go to the spam folder. So please add my email ID to your address book so that you receive emails on time. So thank you so much. We'll meet again next Saturday. And I wish you all a wonderful weekend ahead. So thank you so much, sir. Wishing you a
Thank
wonderful
you. God bless you.
Thank you so much, sir. Thank you so much, sir. Thank you. Thank you.